More than 70 million Americans depend on Medicaid. The service is paid for by taxpayers and provides much needed medical services.
Tonight, a government watchdog group says the agency that oversees Medicaid is not running the program like it should. Channel 5's Steve Solis joins us live in our studio with those details. Steve.
Well, Medicaid is one of the largest payers for health care in the United States. It provides health coverage to low-income people, many right here in the Valley. The Government Accountability Office says the group which runs the program needs to fix a few things. The Department of Health and Human Services is in charge of Medicaid. Essentially, money trickles down from the feds directly to the states. The idea is that states better know what their citizens need than the feds do. It's the state's job to hand out funds to the people and agencies who need it most. Well, the GAO's Carolyn Yoakum says that's not entirely happening. She says Medicaid improperly paid out about $36 billion just last fiscal year. The GAO says the problem lies with states not doing a good job of keeping track of the money. Yoakum says it's hard for the feds to know when states are paying the right people for the right services.
The other danger in a program integrity environment is providers can move. So they can get identified in one state, and if they are a bad actor, then move to the next state.
Yoakum says states often run behind in letting the feds know information about those providers. She says that opens the door to potential cases of fraud, cases we've told you about, like a McGowan woman who just last month was charged with 6 counts of healthcare fraud and 3 counts of aggravated identity theft. And then last summer, 7 people here in the Valley were part of a larger fraud takedown for allegedly submitting false and fraudulent claims to Medicaid. Well, the GAO says the Department of Health and Human Services needs to make some changes immediately. They say there needs to be more program oversight as well as quicker access to information about who's getting money and how it's being spent. Well, the agency in charge of Medicaid agrees and says it's now working to fix it. Live in the studio, Steve Solis, Channel 5 News at 10.